5. Miniature stroke symptoms. You can't ignore. Miniature strokes, or transient ischemic attacks, can be subtle yet critical warning signs of a more severe stroke. Understanding these symptoms is vital, as they often precede a major health event. In this video, we'll identify the 5 miniature stroke symptoms that you can't ignore. Stay alert and informed, as knowing these signs can be crucial for timely intervention and prevention. But before we dig in, can you do us a favor? Help us spread this life-saving message by hitting the thumbs up. And if you're new here, don't forget to subscribe to Combat Heart Disease and click the bell icon so you never miss out on our new videos. And stick around to find out how to get 2 heart health free gifts. We guarantee both you and your heart will love them. Let's get started. Number 5, intense headache. An intense, sudden headache that appears without warning can be particularly alarming, especially when it feels unlike any headache you've had before. While severe headaches are often linked to migraines or tension, a sudden and severe headache could also signal a miniature stroke, or transient ischemic attack. These headaches might indicate a temporary disruption in blood flow to the brain, or even a small intracerebral hemorrhage. Such a headache is often described as the worst headache of your life, and this characterization is crucial for differentiating it from more common types like migraines or tension headaches. Statistically, around 10 to 15% of people who experience a TIA will suffer a full-blown stroke within 3 months, and in some cases, it can happen within 48 hours. This makes it critical to recognize the signs early. Additionally, certain medications, including vasodilators used for heart conditions, excessive caffeine, hormonal treatments, and some antidepressants, can exacerbate this type of headache or trigger severe headaches, further complicating the situation. It's also worth noting that in rare cases, a sudden severe headache could be a sign of a brain aneurysm. If you experience a headache of this nature, it's essential to remain calm and immediately cease any physical activity. Find a quiet, comfortable place to rest and avoid any stimuli that might aggravate the headache. As you address this headache, keep in mind that there are other subtle signs that can also signal a problem. Number 4, loss of balance. If you suddenly feel dizzy or lose your balance, it could be more than just a fleeting moment of vertigo or dehydration. Such sudden dizziness or imbalance may indicate a transient ischemic attack, where the brain's coordination centers experience a temporary reduction in blood flow. This interruption can lead to symptoms like dizziness, unsteadiness, and even nausea, as the brain struggles to maintain its normal functions. During a TIA, the areas of the brain responsible for balance and spatial orientation may be affected, causing a sense of disorientation and instability. This can make simple tasks, such as walking or standing, increasingly challenging and potentially dangerous. The dizziness might come on suddenly and be accompanied by a feeling of lightheadedness or a sensation that the room is spinning. Certain medications can contribute to sudden loss of balance or dizziness as side effects. Antihypertensives like beta blockers and alpha blockers can cause a drop in blood pressure, leading to dizziness, especially upon standing. Antidepressants, particularly tricyclics and SSRIs, may affect balance, particularly in older adults. Anti-seizure drugs like phenytoin and carbamazepine, sedatives and hypnotics such as benzodiazepines, diuretics used for hypertension, and opioid pain medications can all impair balance and coordination. While waiting for emergency response, it's crucial to sit or lie down to prevent falls and avoid moving around too much, as this can worsen the dizziness or increase the risk of injury. Ensuring a safe environment and keeping still can help minimize the risk of accidents until help arrives. Alongside these sensations, other symptoms might also emerge, further indicating that immediate attention is needed. Number 3, difficulty speaking. Speech difficulties can vary from subtle to severe, including slurred speech or even a complete loss of the ability to communicate. This may manifest as trouble forming coherent words, speaking in an unclear or garbled manner, or difficulty understanding what others are saying. The challenge can be fleeting, lasting only a few minutes, and might be easily mistaken for stress or fatigue. Such episodes are particularly concerning because they may not always be persistent or dramatic, leading individuals to underestimate their seriousness. Even a brief period of speech impairment can be a significant warning sign, as the brain's language centers may be temporarily deprived of adequate blood flow. Difficulty speaking, including slurred or impaired speech, can be caused by several medications. Antipsychotics like clozapine and olanzapine may lead to speech problems as a side effect. Anticholinergics such as diphenhydramine and tricyclic antidepressants like amitriptyline can impact cognitive and motor functions, causing speech difficulties. Certain chemotherapy drugs, such as methotrexate, can affect the nervous system, leading to speech impairments. If you experience these symptoms, it's important to stay calm and use nonverbal communication methods, such as gestures or writing, to convey your needs. This approach can help bridge the communication gap until professional help arrives. As we discuss these signs, it's crucial to also address some common misconceptions surrounding miniature strokes. Common beliefs and misunderstandings regarding miniature strokes often revolve around their severity and long-term impact. Many people mistakenly think that because the symptoms of a TIA are temporary and resolve quickly, they are not serious or don't require urgent attention. This misunderstanding can lead to a dangerous situation, as a TIA is a major warning sign of an impending stroke. Additionally, some believe that a TIA will automatically lead to a major stroke, which isn't always the case. However, a TIA significantly increases the risk and should prompt immediate lifestyle changes and medical intervention to prevent future strokes. With a clear understanding of these misconceptions, let's turn our attention to another important sign. This symptom can provide further insight into the presence of a miniature stroke and its potential impact on your health. Number 2, vision changes. Experiencing sudden changes in vision, such as blurriness, double vision, or temporary blindness in one eye, can be a significant indicator. These visual disturbances occur when the brain's visual centers are temporarily deprived of adequate blood flow, affecting how you see. Such vision problems may present as sudden blurriness, where objects appear out of focus, or double vision, where you see two overlapping images of a single object. Temporary blindness in one eye, also known as monocular vision loss, can occur when the blood flow to the eye or the part of the brain responsible for visual processing is interrupted. Although these symptoms might last only a few moments, they are crucial signs that should not be ignored. Certain medications can cause sudden changes in vision, such as blurriness, double vision, or temporary blindness. Corticosteroids, like prednisone, can lead to vision disturbances due to their effects on fluid balance and eye pressure. Anticholinergics, such as those found in some antidepressants and antihistamines, can cause blurred vision by affecting the eye's ability to focus. Anti-epileptic drugs, such as topiramate, may also cause visual side effects, including double vision. If you experience any abrupt changes in your vision, it is important to avoid straining your eyes further. Close your eyes, rest in a dimly lit room, and try to stay still until medical help arrives. Taking these steps can help prevent worsening the condition and ensure a more accurate diagnosis and timely treatment. Before we unveil our number 1 symptom, let's pause for anticipation. To support you in fighting heart disease more effectively, we're thrilled to offer 2 extraordinary free gifts we've compiled just for you. First up, we're giving away our exclusive ebook, 7 Foods That Clean Arteries and Prevent Heart Attacks. This is no ordinary list. It's a treasure trove of culinary delights that are both mouth-watering and beneficial for maintaining stable blood pressure levels. And lastly, you'll gain access to a breakthrough video, the shocking cause of cardiovascular disease and what you should do starting today. This innovative approach, the ancient signaling molecule found in our ancestors, offers a potential paradigm shift in how the nectar of gods can help restore it for optimal heart health. It's a piece of knowledge too valuable to miss. To claim these incredible 2 free gifts, simply click on the link in the description below. Now, let's return to our countdown and unveil the number 1 symptom that stands as a pillar in the 5 miniature stroke symptoms you can't ignore. Number 1, numbness, The most critical and often most recognizable symptom of a miniature stroke is sudden numbness or weakness, particularly affecting one side of the body. This symptom can manifest in the face, arm, or leg and often indicates that a specific region of your brain is not receiving adequate blood flow. Recognizing this symptom quickly is crucial, as it often serves as the first warning sign of a potential major stroke. Studies show that nearly 85% of strokes are ischemic, meaning they are caused by blockages that prevent blood from reaching the brain. According to research published in Stroke, Journal of the American Heart Association, patients who experience sudden unilateral weakness have a significantly increased risk of suffering a major stroke within the first 48 hours. Early intervention during a TIA can reduce this risk by up to 80%, dramatically improving long-term health outcomes. It's important to note that certain medications can mimic the symptoms of a miniature stroke, causing sudden numbness or weakness. Similarly, chemotherapy agents like cisplatin and paclitaxel can lead to peripheral neuropathy, resulting in numbness or weakness in the limbs. These medication-induced symptoms require careful monitoring to distinguish them from those caused by a TIA. If you experience sudden numbness or weakness, particularly on one side of your body, do not attempt to self-diagnose, as early treatment is essential for preventing a major stroke. So, there you have it. 5 miniature stroke symptoms you can't ignore. Now, we'd love to hear from you. Which of these symptoms have you experienced? What did you do during the onset of that symptom? If this video has illuminated new possibilities for you or reinforced your current health strategies, please show your support by hitting the like button, subscribing to Combat Heart Disease, and also make sure to hit that notification bell so you get instant notifications whenever we upload new videos. And to those considering showing extra support, the Super Thanks feature is a great way to help us continue providing valuable health insights. Before you go, remember to check out the 2 exclusive free gift links in the description below. Remember, your health is in your hands. Thank you for watching. Stay vigilant, stay informed, and here's to your health.